So you'll remember in my last video I talked about how the effectiveness and the safety of the Hubbard method of detoxification is of the exercise, sauna, mega nutrient therapy, etc. So the thing is, there were a series of deaths, and you can read this on your own, but the fact of the matter is, they were told flat out, or at least I should say so. Let's see here. So, let's see here. So, Narconon is not a medical rehab facility. Remember, I say the reason this was splashed all over the news, and I don't think I'm lying here, the reason this was splashed all over the news is because Narconon is a legitimate alternative to the establishment. People die all the time in rehabs and mental health facilities, and you don't hear the news talking about it. Certainly not enough. For example, this was in Oklahoma, and it made such a news story that I heard about it in Pennsylvania. Okay? So drug addiction there isn't treated with drugs, but so keep this in mind. It works because it actually treats the root cause of the addiction. So drug addiction isn't treated with drugs at Narconon, but by teaching communication and life skills, according to Smith. First, realize what the problem they were trying to solve by doing drugs or alcohol was. Okay. Secondly, try to help improve their life skills in the area of communication, problem solving, problem identification, and also to help them improve their moral values. Because you have to understand, a lot of the reasons people are on these drugs is they don't have the moral values, the self-respect to not do this to themselves in the first place or do this to their families in the first place. So, nearly 75% of the staff is made up of Narconon graduates, according to Smith. Ex-users helping users has always had its value. A person who's on drugs will trust an individual who they know has been on drugs, and they will be more honest with that person, said Smith. Narconon staff must meet all state-required training before being hired, Smith said. Any former addict must be stably recovered before they are allowed to start working one-on-one with those in the program. He also said that no one with a violent criminal history is eligible to work at Narconon. There are individuals who did have problems way back because of their addiction and have fully resolved it and have years of sobriety and have proved they are contributing members of society. Possibly the most criticized practice is... Now, this is what's funny. Now, remember, I pointed out that these are perfectly safe and well tolerated. Research shows this. So the most criticized practices are the sauna and exercise program. Smith said it eliminates cravings by sweating out toxins. The idea there is to improve physical health, and that's what's missing from pretty much every mental health and rehabilitation program in the world. Is instead of improving health, they're destroying health. They're destroying physical health. And when you destroy physical health, a lot of times you're destroying mental health as well. So most people that are addicted are in varying degrees of physical and nutritional deficiencies. Let's just say that. Before starting the treatment, Smith said clients must pass a physical examination. That's to rule out anybody that may have an adverse effect to the treatment. The program starts out with 30 minutes of light exercise followed by 4.5 hours of sweating in a dry heat sauna with cool down and hydration breaks. The treatment also includes a specific vitamin regimen including niacin. Smith said there are two types of niacin: immediate release, which he said is medically safe, and in high doses in sustained release, which he said can cause liver problems. The Narconon sauna program uses instant release niacin and only instant release niacin. The sustained release niacin has never been used because of the potential danger associated with using it in high doses. Gilliam said her son, Gilliam said her son started complaining of severe headaches after the sauna program, but was refused pain medication and couldn't get in to see the doctor. Well, you can't take pain medication because that would go against the program now, wouldn't it? So she claims Narconon promised a doctor would be on site within 24 hours, or be on site 24 hours a day. I know what happened was bad, Gilliam said. Smith told them that Narconon prefers to treat nutritionally first, but does allow over-the-counter medications. So they do allow things like Tylenol and whatnot. If they are medications that are needed to help those potential life-threatening situations get those potential life-threatening situations under control, that's incorporated as part of the treatment plan, said Smith. Narconon employs 7 registered nurses, so it's not like they didn't have people there that don't understand medicine. Nurses generally understand medicine better than doctors, because they're the ones dealing with the patients. Smith said there is always a nurse on site who will see patients at any time, and the staff doctor is always on call. Narconon advertises a 70% success rate, a number Smith said comes from a series of survey calls following program completion, but there are still those 3 deaths which remain a mystery. It's a tough job, so it's 3 deaths, okay? There's people that die from addiction every day. That's a very good point. There are people that die from addiction every day, Smith said. When Gabriel Graves died last October, his mom said Narconon told her he overdosed. The medical examiner ruled that out, but couldn't determine how he died. Hillary Holton died in April, and the medical examiner's report noted some bruises on her body, but ruled her death unknown. We went Stacy turned up dead, yada 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 yada. So, unfortunately, death is part of addiction, Smith said. It's an ugly part. Okay. Now, what happened, I don't know. But the fact of the matter is people die all the time in drug rehab. So, we're going to move on and show that. So, what are the numbers of deaths in drug rehabs? Almost 3,400 patients die in U.S. drug addiction treatment centers. This is in 2015. Almost 3,400 patients died in U.S. drug addiction treatment centers. Many of these deaths were preventable if the staff at the centers had taken the right steps to adequately evaluate the patient's condition and ensure they received the emergency medical care they needed. Deaths in drug addiction treatment centers are relatively rare. Okay? That's a lot of patients to die, though. You get what I'm saying? But that wasn't all in Narconon facilities. The majority of that was in regular facilities, because remember, Narconon is a minority of the total facilities. So this was in medically supervised facilities. Almost 3,400 patients died in 2015. Deaths in drug... Okay, so when we consider the percentages of the number of patients dying in drug addiction treatment centers, centers point to death occurring relatively rarely. About 1.4 million people participated in programs for alcohol or drug addiction in the United States. Less than 1% died. 3,362 people died in the treatment. The families of almost 3,400 people, however, relatively rare, does not matter. Too many healthcare providers underestimate detox and withdrawal. Now, this is a big problem. All too often, serious complications go undiagnosed and patients do not get the care they need, and delay in noticing signs of trouble deter. Now, remember I said this is a big problem because, remember, I pointed this out. So psychiatric medications, especially benzodiazepines and other similar medications and amphetamines, they have withdrawal side effects. A lot of people can't get their drugs filled on time. at these mental health outpatient clinics. You can go into withdrawal, and you can have serious health risks. Okay? So that's a problem. So patients who are undergoing withdrawal and trying to stay clean are particularly vulnerable to medical emergencies. They require attentive healthcare staff who can provide an exam before admitting them to ensure they do not have any health issues, careful monitoring and regular vital checks, emergency medical treatment at the first sign of distress, compassionate and understanding support staff. Drug addiction treatment facilities can work when well managed. Okay, patients often enter rehab because they do not want to die. They hit their personal rock bottom, yada yada yada. Newsom Melton, you see my point here. You see my point. So people die in rehab quite a bit. Mortality among inpatients in psychiatric hospitals, the Indian perspective, results. During the 26 years, there were a total of 103,252 psychiatric inpatient admissions out of 333 people, out of which 333 people died during their inpatient stay. Majority of the mortality was seen in the age group of 21 to 40 years old. Most of the subjects were males and from the urban area. Conclusions: identifying the factors associated with the death of inpatients is of utmost importance in asserting the care in neuropsychiatric hospital and in a neuropsychiatric hospital and formulating better treatment plans and policies in mental health. So let's get down to the conclusion here. Now, this is in India, but Bengal Enquiry of 1818 indicated that the mental health care was suboptimal, and hence there were numerous deaths occurring in asylums. However, the enquiry did not mention the statistics of mortality in mental hospitals, and hence the data of this kind from India is sparse. The mean age of the subjects in the study was 41.84 years, and the maximum death occurred in the age range of 21 to 40 years of age, which are similar to earlier findings. In the context that mortality among men was higher, more than half of the deceased had been admitted for a week or even more recently, a period that can be considered as a crucial period for the subjects. An earlier study finding reflected that about 72% of subjects died within 2 weeks of hospitalization, while 5.2% were chronic patients who were staying over 5 years in the hospital. Nearly 93% of the subjects were diagnosed to have a psychiatric illness, and majority of them, 25.7%, were diagnosed with schizophrenia. So the majority of them were diagnosed with schizophrenia, followed by a mood disorder, so schizoaffective disorder. The diagnostic composition among persons who died in an inpatient psychiatric setting is similar to that in the earlier studies. Many were diagnosed to have a medical illness prior to death, similar to earlier study findings. Among the causes of death, the leading one was cardiovascular disorders, followed by the respiratory system disorder, which is similar to causes. Now, wonder what's causing that? Similar to causes described in the literature. The issue of death during custodial care of mentally ill patients is not an uncommon scene in developing countries or established countries. Death of mentally ill patients should be considered carefully. The following are the factors which can contribute to increased mortality: a lack of manpower, doctor-to-patient ratio. Mentally ill patients are most vulnerable to any physical illness. Disease outbreaks are common in mental hospitals. Non-availability of life-saving medicines and general medicines, and poor protective clothing as per the local weather and environment. Violence among the inmates, suicide or deliberate self-harm, death of mentally ill patients does occur because of negligence. So it does occur because of negligence of staff also. However, many of the mental hospitals in India do follow good clinical practice, probably better than in the United States. Okay, moving forward.